Welcome to My Line of Work. Here we dive deep into the world of work, what people do, why they do it, and how they got there. From dream jobs to unexpected paths, every story matters and every career has a story worth sharing. Today, our special guest is Kyle Ollague. Thank you so much for being here. Go ahead and tell everybody what you do.
Yeah, pleasure to be here. Hi, everyone. My name is Kyle Ollague, and I am a radiologic technologist, also known as a Rad Tech or an X-ray tech.
Yeah. Very cool. And how did you get into that line of work?
Fear. So
There you go.
I'll explain. So when I was in the military, I was going through course school, and during ACE school, there was a part where they showed us kind of videos, just to kind of give us an idea of what to expect for scenarios, where it showed situations where they were out in combat and events were happening, and sometimes you see really graphic events. And I would see these videos and I'm thinking in my head, I don't know if I can do that. I don't know if I can be this kind of corpsman. And so I ended up stopped there. They had like a little job fair going on, and I stopped by and saw that they had X-ray tech. And I thought to myself, this looks interesting. You know, I like taking pictures. You know, I could do this. You know, it's somewhere where they're probably not going to put me out in the field, essentially. So that's kind of what sort of prompted me towards it.
Very cool. And so this wasn't something you always wanted to do. It wasn't a dream job.
Not necessarily.
It was more an unexpected path.
But it was kind of a good unexpected path.
Okay.
It was something that it did intrigue me because I was kind of genuinely interested in, like, medical imaging. So yeah.
Very cool. So when you get your Rad Tech, when you study that, is it kind of like a general, you kind of, or what do you study as far as what kind of scans can you do coming out?
Yeah. So there's many different kind of scans. So normally if you're going for just a simple radiography program, initially you start off with just, simple x-rays.
Okay.
However, you do have those pathways and options to pursue what's called or what's referred to as like post-secondary certifications. All this is done through the ART, which is American Registry of Radiologic Technologists. Okay. So you can pursue post-secondary degrees in stuff like CT, which is computed tomography, MRI, which is magnetic resonance imaging. I used to do ultrasound for a bit for ART. I don't think as much. It's more so, I want to say, managed. You usually pursue that through ARDMS, which is a different organization. But those are some of the different kind of like diagnostic modalities that you have the option of exploring.
Okay. And what did you start off doing?
So initially, I'm referred to as a pipeliner, where I went directly from A school to C school in the military. Okay. So yeah, I studied real hard, got into C school. And then it was about 13 months. The first 6 months was just book work, didactic, practice labs. And then the other 7 months, I went from San Antonio, Texas to San Diego, California, where I went to Balboa. I got to do a lot of clinical work, hospital work, and they not only had us do x-ray, but they also had us do, they also had us dabble in different modalities too, such as CT, MRI, and ultrasound.
Okay. And so is x-ray the first one you learned?
Yes. And it's the first one I learned, but it wasn't necessarily the first one I mastered.
Okay. So, but is it the first one that like all Rad Techs learn?
Usually.
Is x-rays?
Usually. Okay. You do have, you technically, and I'm not 100% certain, you do have some pathways maybe to jump into CT or MRI straight from, but usually for the most part, people tend to go right into radiography as their first, starting point. Yeah. And so what happened is I learned radiography, and then I ended up going to Okinawa after I learned it. Okay. That was my first duty station. Yeah. I showed real good promise through radiography, so they decided to put me in ultrasound. Very cool. So that was kind of a big step for me because ultrasound is considered a very difficult modality out of the different diagnostic imagings you can do. So when I was doing that, I ended up going to Portsmouth because at the time there wasn't anybody that could really train me over there.
Okay.
So
and where is Portsmouth?
Portsmouth's over in Virginia.
Okay.
So yeah, Portsmouth, Virginia. I went
So
off
from Japan, they send you to Virginia.
Yeah.
Okay.
Yeah. They sent me there for about 6 weeks, 5 weeks, because they had to do construction and move the ultrasound machines to a different area.
Yeah.
Luckily, I got to work with some really great ladies over there, really enthusiastic, wonderful ultrasound techs that were very happy to show me the ropes.
Yeah.
I borrowed some books, specifically one that the Betty Bates, the second edition. I remember I would take that thing home and read it. I would read it at work, and I would kind of put into practice as well as what I would see in the exams and what they would let me scan. And in those 5 weeks, I came back a very competent ultrasound tech, and
very cool.
People were kind of blown away by the results.
Nice. Yeah. And then what opportunities did that kind of open up?
That it really gave me more responsibility, I would say, because as for the military, when you are competent, you do end up standing duty.
Okay.
And I got to do exams that were, really strenuous, really difficult. In general, though, if you look at the civilian side, ultrasound is a modality that it will make you a lot of money.
Okay.
You can easily, one of my coworkers, he's ARDMS certified, and he got a job offer from a location. They were willing to pay him over like $3,000 a week to work hours. So it's good. And to be honest, like that's a good amount of money, but it can even scale up higher. Yeah. It can kind of be tough to sort of put like a price range sometimes on these modalities, because I've seen techs that I remember even seeing on TikTok, this lady saying she made almost $1 million a year doing it.
Wow.
There's probably a lot more involved in that, but it's a job that can really scale. So you get a lot of opportunities as an ultrasound tech. Okay. You can even dive into certain subsections of that. So you can specialize in abdominal scans and pelvic scans. Okay. Some even make you a lot of money. Musculoskeletal qualified through ARDMS. I knew a guy, his daughter, I believe she did ultrasound for like a big basketball team. It might have been the Lakers.
Really? Wow.
She would always be able to get like front row ticket seats, but she was making a lot because she was their ultrasound tech.
Man, very cool.
Yeah.
So ultrasound is a like a general, but you can specialize in different areas of ultrasound.
Absolutely. You can, like, even within ultrasound, you can go into different specialties too.
Wow. Are all the scans like that? Can you do that with X-ray and CT? Can you specialize and kind of, become an expert in scanning certain things?
In a way, yeah. I will say for X-ray, I know at Balboa, they have an ortho clinic. And for the ortho clinic, it's usually, I remember when I went through there, the ortho techs, their specialty was getting ortho shots. So all they would do in the ortho clinic would be and to kind of clarify, ortho views are usually extremity views that orthopedics will send over. So stuff like weight bearing. So you might have a regular X-ray of a foot, but a weight bearing foot is usually involving when somebody is standing. So they're specialized with getting like the accuracy of those ortho views specifically that they want. So it's not really like an official kind of subdivision or like a different category, but if you specialize in that and you have experience, they might put you there if that's what you excel at. Or maybe you have experience with fluoroscopy. So they might have you work in fluoro in the military. I know on that side where you're doing like scans or you're doing x-rays with contrast, as well as you're assisting the radiologist with like abdominal scans. So like barium swallows, for example, you're mixing the contrast, you're preparing everything, and then you're watching in real time as somebody drinks.
Really interesting.
It's cool because you get to see the contrast go in, and it looks like somebody's just actively drinking milk, essentially.
Oh, really?
It's really cool.
Awesome.
I got to try it once just to, for purposes of just seeing what my patients are drinking. And to me, maybe I think it tastes different to everybody else, but to me, it tasted like bananas and marshmallows.
Really? Was that good or bad?
I was like, I kind of wanted to drink more.
Yeah.
The radiologist
was
looking at me weird. He was like, what?
That's funny.
Oh yeah.
Very cool. Wow. Okay. So what do you do now? What is your degree in? You studied Rad Tech, and then so what are you doing now?
So yeah, my degree was in general studies.
Oh, that's
so
right.
nothing too specific.
Yeah.
Right now, I just got to San Antonio,
Okay.
and I'm actually gonna be an instructor, so I'm gonna get to teach everything. So it's a bit different of a pathway from where I was going to before.
Yeah.
Whereas initially I was an X-ray tech, ultrasound tech in Okinawa, and then my second duty station in Pensacola, Florida.
Okay.
I got to learn CT, which is computed tomography.
Okay.
And with computed tomography, I learned it at a good time and from really, really amazing CT tech there too, who really instilled a mindset and respect for it. Because right after I kind of learned it, I ended up going to Afghanistan.
Oh, wow.
And that was it was one of the most challenging, but also I'd say one of the most job rewarding, like, as far as like pride of what I did. It was very rewarding experience because when I got there, I had to work with CT machines, ultrasound. But I was kind of hopping around modalities, and not usually something you do in a civilian world. Because you end up going from, in my case, I would end up outside the hospital wearing my helmet, wearing my bulletproof vest. I would bring patients from helicopters if need be.
Wow.
Make sure they didn't have weapons. They'd go straight to the bed. I'd get a portable X-ray. And then right after that, they'd go right to CT. I'd end up scanning them. Then I would reconstruct the images if that's what the doctors wanted. And then usually after that, I'd follow straight up into the OR, where I would take the C-arm, which is it's like a portable fluoro machine that the surgeons will use to for surgeries, just to make sure things are in place. So that was it was kind of intense, but I think it really solidified everything that I had learned at that point too. And I was
very cool. That sounds like it will kind of make you put everything into practice, right? So pardon my ignorance, but so X-ray scans, you're looking mostly at bones, correct? Okay. And then CT, what are you looking for?
CT. So if you want to put it that way, X-ray. Now you can do other things with X-ray, but majority of the time, that does show bones. With CT scan, you can do bones, you can do 3D reconstruction. With computed tomography, though, you get like the axial views, and you reconstruct them into different planes as well. So because it used to be computed axial tomography, and that's why a lot of people called it CAT scan originally. So whenever you hear people talk about CAT scan, it's the same thing as CT. But you're taking those axial segments. So it would be like if you take, if you're slicing the human body up into little different, slices, and then now you're compiling the data and you're putting it in different planes. But it allows you to see, it gives you like kind of a more like 3D-esque kind of picture and perspective on things. And not only that, but you can see how contrast interacts as well with like different organs. So you're not only just seeing bone, you're also seeing tissues as well. And you're seeing it, and CTs are fairly fast when they scan. They use a good amount of radiation compared to X-rays too. So you're getting a lot from CTs. It's very useful when you're. And have you ever had appendicitis by any chance?
No,
you haven't. That's good. Usually,
I do have a funny story though. I'll share about that. My friend's son, he was, I don't know, 8 years old, and he had that. And they played soccer together, and so his parents let me. I was the coach at the time. He let me know, hey, he's gonna be out because he has appendicitis, whatever. Well, my son, who was also 8 at the time, ended up talking with his friend, And his perspective of it, he came and told my wife, he's like, "Oh, Carter got his guts taken out." That was his understanding. Like, they took his guts out. And I was like, "No, they didn't do that."
No.
Yeah. So, but no, thankfully, I've never gone through that.
Yeah. Usually CT is the modality of choice for that.
Okay.
Yeah, because when you put contrast in, it actually highlights the appendix. Yeah, it actually kind of looks like the thing that sticks out of a tire tube, even when you look at it on there. So yeah,
And an appendix is pretty small, right?
Yeah, it can be. So when you do it, it's not necessarily meaning somebody doesn't have it per se, but usually CT is the best modality. But I have seen it both in CT and also when I did ultrasound too. Okay. I've seen it probably about, I want to say 3 times.
Yeah.
It looks like you're looking at, like kind of I want to say like a donut.
Really?
A little bit. Yeah. It's like nice and circular if you angle it, especially if it's acute usually. Okay. So, and
with ultrasound, other than obviously scanning a pregnant woman, what do you use ultrasound for?
Oh, this is gonna be fun. Yeah. I've done some interesting ultrasounds. Okay. A lot of people, you're right, they do think it's usually scanning a pregnant woman, but you can do it for abdominal scans. Okay. You can do it for appendicitis, testicular ultrasounds. Oh, wow. You can do that as well. You can do pelvic ultrasounds. You can do superficial ultrasounds, like if somebody has like a ganglion cyst or lipoma, and they just want to make sure that it's nothing beyond that, you can do that. Oh, okay. I've done some weird ultrasounds. So I've done ultrasounds of the eye, and the teeth. Really? It's you don't normally do that. Yeah. I had a dentist one time. They requested a teeth ultrasound in Okinawa. Teeth ultrasound. And what would an ultrasound give you that an X-ray wouldn't when you're scanning it? For teeth, I don't know. I was. Oh, but they requested it, so sometimes, yeah. Okay. Sometimes there are moments, and in your line of work too, you'll be prepared, but there's going to be things that maybe come up that you don't normally see. Okay. And teeth is not something that right off the bat you would know, because it's something I kind of had to look into and just kind of come up with my own protocol and see why they wanted to look at it too. So I had to kind of learn the numberings for teeth, because dentists go by 1 through 32. So I had to learn, like to make sure that the teeth were being labeled correctly as I'm scanning them. And it was mainly bone you're seeing. So didn't know what he wanted, but he was happy with the results. So cool. I think I did good, but he actually told me himself. So that's usually a good sign. Yeah. Awesome, but yeah. So what does your day-to-day look like? Kind of what's your schedule? How early do you come in? How long are your shifts? What, how late do you get out? What does that look like? So it can be varied, but I'll give you like a example of a typical day. Sure. So, and I'm probably go this off Pensacola usually, but I would get there probably maybe at 6 a.m. if I have the morning shift. If I'm the first tech on stage, especially for clinics, usually the machines are down. Okay. So what I'll do is I'll boot up all the machines. I'll make sure they're running properly. Okay. I'll run QC or QA. Sometimes it's labeled different, which is like kind of quality assessment or quality control. Yeah. And I'll, make sure that the machines are shooting accurately. So, we get accurate images. Yeah. I'll warm up the machines as well. So that way, the tube is not being shot cold. Okay. And then I'll also check the schedules to see if there's any patients that have particular instructions for certain modalities. Like if they need to be fasting and they're already there, I'll make sure that the patients follow instructions. Yeah. I'll check lab work if need be. And then I'll also check to see if we have any surgeries coming up to see if we need to send anybody up to the OR to operate the C-arm. So a lot of the prep work though afterwards is just after that happens, you're just kind of usually running your job. Usually if I'm doing X-ray, I'll get an exam come up. It'll populate, it'll print off or I'll get a call from
Mhm.
somebody to tell me to go do a portable.
Yeah.
Either or, I'll get that. I'll verify that the information's correct, just to make sure, and then I'll go out, I'll get the patient,
Yeah.
check to make sure that this is the patient I'm scanning and this is the
Mhm.
right part. Doesn't happen often, but every now and then you might get a patient that they're here for a right hand and they get maybe like a left elbow. So
Oh, wow.
you always want to make sure
Yeah.
it's,
Yeah.
safety is a big part of the job too. So,
Okay.
especially for, certain modalities, MRI is a great example of that.
Mhm.
You're working with a really strong giant magnet,
Yeah.
has a much stronger force than Earth's gravity too. So,
Oh, wow.
I don't know. Have you ever seen any pictures of MRI accidents by
No, I
chance?
haven't.
You should Google it and see.
Yeah.
We have the MRI safety is a big aspect of MRI
Okay.
for a reason, because sometimes, there's been incidences where, because it's a giant magnet,
Mhm.
sometimes people will bring in gurneys, and if they're not careful, next thing you know, when they get into that
Really?
range, when they get
Yeah.
into that range and they hit that Gauss line,
Mhm.
all of a sudden that gurney just flies, and it
Wow.
just it flies fast too,
Yeah.
and sometimes, like, patients get injured, at worst case
Really?
even death. But
Whoa.
so you have to be very careful if somebody's coming in a wheelchair, and
Yeah.
you have to make sure that, you transfer them over to a wheelchair that is MRI safe.
Ah, okay.
So, we a lot of different safety protocols
Yeah.
involved. You have to know how to, stop the machine if need be to,
Yeah.
get somebody out safely. So yeah, it's a lot of
Wow.
big on safety for MRI.
Yeah. Yeah, that's
for
important.
for a lot of modalities, yeah, they usually involve that safety.
Yeah.
Not just for magnetism, but just because you also have, with radiation too.
Yeah.
X-ray is not usually. I'd have to probably X-ray you like 40,000 times in a row in order to give
Ah,
you rad
okay.
poisoning,
Really?
just to kind of give you perspective.
Yeah.
A lot of people ask me, or sometimes a lot of people will, they'll be a little bit afraid of that,
Yeah.
and I have to tell them, like, for example, like, what's the longest flight you've ever been on?
I went to Hawaii, which was 5, 6 hours maybe
Okay, all right,
from California. I think it was like a 5-hour flight maybe.
okay,
It's probably the longest.
okay. If I remember correctly, about 40 every 45 minutes you're up in the air.
Uh-huh.
That's about the equivalent of, you're getting about the same amount of radiation that you get from a chest X-ray.
Really?
So yeah,
Oh,
but
wow.
the thing
From the
is
plane?
from it being up
Interesting.
that high. But the thing
Oh,
is
wow.
you're not negatively impacted by it
Yeah.
though, because like I said, I would have to take a machine with X-ray specifically, and I
Yeah.
guarantee my machine's going to break down way before I even had a
Yeah.
chance.
Well, I
Um,
think they scare you because they make you put on that vest and then they
yeah.
leave. They're like, "All right, you stay here. I'm gonna go to the safe zone."
Oh
I think
yeah.
that's maybe part of it why people don't trust the X-ray. They're like, why
I,
can't he be here?
I remember when I used to do night shifts in
Uh-huh.
Okinawa, there'd be a couple of times, and I kind of play a little bit of a prank, especially on the nurses,
Uh,
because a lot of times they tend to get pregnant. So,
uh-huh.
you it's not really, not really going to harm them, but
Yeah.
sometimes if they were talking a lot and I needed them to clear, I'd be like, X-ray, and all of a sudden they look around and
I
just
gotta go.
scatter, like, oh my gosh, and I'm like, I'm just kidding, ladies. It's just, one of the doctors is like, don't get the pregnant ladies to scare like
Yeah.
that. I'm like, well, I'm
Yeah.
taking an X-ray, but
Yeah.
um, but I understand that there is that fear.
Yeah.
I know that there's been a lot of discussion. I think probably I remember reading about it. I think 2015, 2016
Mhm.
timeframe. There's been like that discussion of, for lead shielding, is it really effective in terms
Mhm.
of like certain exams, like for basic X-ray?
Yeah.
It's still recommended to wear it for like fluoroscopy, because
Mhm.
with fluoroscopy it's continuous radiation,
Oh, okay.
so it would make more of a difference.
Yeah.
Or even during, like, when you're up in the OR, because it can be continuous as well.
Yeah.
So usually those big lead vests that people
Mhm.
see will usually be kind of found in those modalities
Okay.
specifically. Whereas nowadays people just kind of tend to have like the little aprons that kind of go around you,
Yeah.
because, you're just kind of protecting the sensitive areas
Yeah.
ultimately, like, genitalia, for example.
Yeah.
But yeah, We'll see. Yeah. I mean,
Yeah.
I don't really, I'm kind of more in agreement with the effects of it not really having an effect
Yeah.
except for those modalities. But I
Yeah.
mean, you have those circumstances that I think people read about, such as with CT, for example.
Mm-hmm.
I remember reading about a case, I think it was in California, where this child ended up having their brain fried
Really?
because it was like an overpowered slice one at a time, and
Mm-hmm.
the tech wasn't really quite aware of, and they should have been aware though,
Yeah.
but they didn't really quite think anything of it. And then because
Wow.
there was like a big legal issue of,
Yeah.
because the protocol was set up that way, is it the tech's fault or is it the hospital's fault?
So he
Because
was following protocol.
yeah, they were following protocol
Yeah.
according to the machine, but
Yeah.
as a tech, that it's something that you have to be aware of. Like if,
Yeah.
so like if I noticed that, I'd be like, okay, well, let me stop the machine, see
Yeah.
if, did I select the wrong protocol? Did I accidentally hit settings? Or if for some
Yeah.
reason this is what the machine's doing, then I
Yeah.
need to get somebody involved to, like, fix that. Cause you do have to be aware of those kind of safety
Yeah.
issues. Not even just for radiation, but I know when it comes to contrast,
Mm-hmm.
you have to be aware of any side effects like allergic reactions, or even how it could play. So for CT, one of the things you're usually worried about is how contrast can affect the kidneys.
Mm-hmm.
So you do have to look at lab values and make sure that people are able to, especially the older population, that they're
Yeah.
able to, that their kidneys are going to be able to handle that contrast.
Wow.
Because otherwise, if if their kidneys aren't, you're going to have another problem on your hands on the table. And so, yeah, we're very, yeah, it's we're really big on safety, I'd say,
Yeah.
as a whole,
Yeah.
going forward with it.
And are there how often do those safety precautions um become updated, for lack of better words?
I'd say the Navy, I would say probably maybe the civilian sector about the same as much, but we do our best to definitely review them fairly often.
Yeah.
Um, I want to say at the very least, probably like as soon as something new comes out, that
Yeah.
gets reviewed, as at least yearly, maybe bi-yearly.
Okay.
Or if, let's say there's like an incident. So I remember we had an issue one time where, um, for acupuncture,
Mm-hmm.
people on Okinawa were getting like ear acupuncture done, but we had a circumstance where I guess one of the needles wasn't removed,
Oh wow.
and they went to MRI. The thing is when we check you with MRI, we do a survey, we conduct it, we also go over the survey once again after you filled it out, and we're
Yeah.
very extensive and thorough about each individual question to make sure you don't have any metal in you.
Yeah.
And not only that, but then we'll also scan you again with a wand, and we will,
Yeah.
we'll make sure you don't have any metal on you when
Yeah.
you go in. The thing with the ear acupuncture needles is they're so tiny
Yeah.
that it can't even pick up that for the
Really?
wand.
Yeah.
Most of the time, it doesn't pick it up.
Okay.
So, and luckily, nothing bad happened to the
Yeah.
person, because they just talked about a huge discomfort behind their eye.
Oh
Like it was
wow.
kind of like almost gonna pull it through.
Yeah.
We got him out quick, but that was something that we had to update for our safety
Wow.
policy. Yep.
Yeah.
We had to, and then I remember on the sheet, it then included like, have you had ear acupuncture recently?
Yeah.
Because yeah, that was
Wow.
that
And
was a
then do
big
y'all
concern.
share that information? How far do y'all share that information?
From my understanding, I think usually they have these kinds of discussions on a higher level.
Yeah.
I know definitely everybody that works in the hospital, like everybody in the department is aware of that too.
Yeah.
So I know
Yeah.
as far as hospital wise goes, like we all get updated on
Yeah.
safety features. And I believe that when they have those meetings at a higher level, military wise, they also discuss that too. They're also saying, well, this is something that we had occur. So this is something, we're usually really proactive in order to do our best to prevent future mishaps.
Yeah.
So
very cool.
Yeah.
And going back to a typical day, so you get there at 6, and then typically how long is your shift?
It depends.
Okay.
Normally, if it can be an 8-hour shift.
Mm-hmm.
But that being said, if from a military perspective, I've also had shifts that have, I've had shifts that have lasted longer.
Yeah.
It was even for ultrasound when I was on duty one time, I remember just about working almost like 40 hours straight because we had
40 hours.
we had a lot of cases at one
Wow.
point. And I remember the radiologist, they were like, I saw you here like 20, like you're still here after 20 hours. I was like, yes, sir.
Wow.
Yeah. So sometimes you do get a lot of work.
Yeah.
On the military side, you can.
Yeah.
Civilian side, though, to kind of touch on that, sometimes you can have 8-hour shifts, but sometimes you can also have 12-hour shifts.
Yeah.
Maybe 20. I don't really think 24, but maybe that could be a possibility.
Yeah.
It's a good, and one of the things I like about being a rad tech is that you do have like flexibility in your job. So I've had friends who they got out, and I knew a buddy, he was going to college, but he would do 12-hour shifts over the weekend, and then he was able to make a lot of money from that. And then,
nice.
And then he'd be able to go to college during the weekdays. So, and that's the cool thing is it's a very flexible job with very flexible hours. So
the certification you got in the Navy, you're able to use it on the civilian side?
Yes.
You can go anywhere?
Yes. So the only thing that you need extra usually is depending on the state's rules. So if I want to moonlight in Texas, I'll need a Texas license in order to do that. Which it's not usually, like I'm not usually taking any extra tests. I'm usually just applying for one. And as long as I'm in good standing, I usually get it. I think one of the only exceptions is California, because they usually make you get a fluoro license first before you also moonlight usually. So yeah, it kind of depends on where you go, but for the most part, I can do that.
That's good.
So I can do that with my radiography license and my CT license. So
and then your rad tech, you have a license, and then the additional scans, are those additional certifications or licenses, or how does that work?
Yeah, so my primary is radiography, but my post-secondary is CT. And I'm putting it on hold because I'm focusing on my military quals and certifications right now first as an instructor. But after that, I'm going to go and finish up on my MRI certification. And usually if you have those three, it helps not only find a job, but, you get more opportunities available, especially. And one of the things I will say, if you want to travel and see the world, this is a good job to look into because you can be a travel tech. And the cool thing is you'll make about as much as a travel nurse. And because nurses usually make more in a regular hospital setting.
I heard when they travel, it's a good gig.
Oh yeah. Yeah. It's amazing. I've known a lot of people that have become travel techs, and they love seeing the world at the same time as being a travel tech too. And the pay is good for them.
There you go.
Definitely something to consider. Oh man. And there's a lot you can really, there's a lot of, I want to say there's really a lot of job growth and opportunities, even beyond just getting certifications too. You have options to not only just from a scanning point of view, but even for like a computer kind of side of things. We use PACS for imaging transfer. So, you can, if you want to become more marketable, sometimes I'll suggest to folks, like learn to become a PACS administrator.
What's a PAC?
So PACS is kind of like the system we use to where we receive images, we transfer images. Readings will be put on them. We'll also encrypt them. If we're, we'll use DICOM encryption if we're putting them on a disk. Just kind of give like a general idea of it. When you have, and I think this is where some people will tend to make more money. So if you learn how to do that, and then you also have some other computer certifications like your TIA, you can kind of use those in tandem. So for me, I have my A+, so it kind of gives me a better idea of how systems work. So it kind of helps for the hiring process, because even if you can't fix it, you can usually give your company a better idea of who can going forward. So yeah, you can do that part. You can also
Cool.
dabble in rad safety if you want to.
Mm-hmm.
So, those guys usually consist of a physicist, but they're responsible, for checking levels of radiation.
Okay.
You can do that pathway as well. And if you want to go even above that, you
Yeah.
can look at becoming a radiologist assistant or a
Mm-hmm.
radiologist. And those
Yeah.
are, yeah, you're making really good money
Yeah.
when you go up to
And
there.
that radiologists are considered doctors, correct?
Yes.
That's the difference between a tech and a radiologist.
Yes,
Okay.
yes. Some radiologists, yeah, they are doctors.
Yeah.
It is a lot of school,
Mm-hmm.
because you spend a lot of time learning how to read as well as doing procedures.
Okay.
But it is, I've heard a lot of good things in terms
Yeah.
of like the amount of, if you want to go up that high with your
Yeah.
education, it's really good money.
Yeah. Cool.
My buddy was working and he had to go up to a radiologist's offices real quick, and
Yeah.
he remembered saying that the radiologist was talking to his doctor, and I think she needed money for college, and
Yeah.
he didn't mean to like glance, but he remembers seeing this guy take out just a blank check and just writing six figures easily like it was nothing,
Wow.
and just giving her the
Interesting.
money for college. And I'm just
Yeah.
he was taken aback. He's like, he just wrote it like it was just pennies almost.
Wow.
And they can, yeah, they definitely can make a lot of money.
Yeah.
And the cool thing about being a radiologist too is you also have the opportunity to work remotely from home.
Oh,
So
interesting.
you don't even really, yeah, there's a lot of radiologists that will,
Yeah.
some will even moonlight too
Yeah.
in the military, and they'll work off
And
side.
so are they mostly interpreting the images that you're scanning?
In general, yeah,
Okay.
they're responsible for, making that final, making that final interpretation off
Okay.
the images.
Yeah.
And then after that, they'll write that up, and then
Mm-hmm.
that way the doctor that ordered the image, because usually your physician will order the images, they
Yeah.
can take that reading, and then ultimately it'll lead them to what direction they want to take with the patient
Yeah.
too. So
Very cool.
yeah.
Well, on that note, you kind of talked about traveling and the financial side of
Yeah.
it. What are some pros and cons about, your line of work that you've kind of seen throughout?
So I will start with the pros. Pros are, you can have flexible hours.
Mm-hmm.
You don't necessarily need a lot of education.
Yeah.
So you can have a really good job. And that's a cool thing. If, let's say, you decide it's not your line of work,
Yeah.
you have a good job that you can work flexible hours with towards getting something else.
Yeah.
Another pro, I think, is more so job satisfaction too.
Yeah.
I didn't realize how much job satisfaction I would get interacting with patients,
Oh, cool.
but that has been a big one.
Yeah.
Man, I kind of like my job. I don't know if it's going to be easy to come up with like a con, to be honest, because it's really hard. I would say the cons would be, it can kind of be like a mobile job a little bit. So you do have, there are times when you do have to be on your feet, especially if you're military too, if you're in those active zones, it can be a really on the job kind of feet thing. So yeah, you really got to go for that.
So it can be physically exhausting. Just
it can be at times, especially if you have to work with a mass casualty.
Mhm.
Then yeah, it's going to be really physically demanding.
Yeah.
Even just with standing up sometimes, like if you're doing procedures or if you're in the OR, sometimes the OR, they might need you for a while. So you might be standing up for a while along with them. Not as long as the surgeons usually, but you might be there for a while.
Okay.
So yeah, it can be physically demanding. And I want to say that physically demanding, and sometimes, I guess, because you're working in a medical field, if you're not used to those instances where you might deal with a lot of blood, if you may be a little bit queasy, it could be, if you might have like a light stomach.
Is that common by the time they get to you to where you're scanning? Is blood common?
Not necessarily. I would say it was common when I deployed.
Okay.
However, sometimes you do end up in circumstances where maybe not blood's common as much, but sometimes just when you see patients that can kind of shock you a little bit.
Okay.
So just to kind of give a little quick story,
Sure.
probably this memorable. I have tons of, but this one always comes up to mind every now and then.
Yeah.
I remember as like a new tech when I was first on nights and I got to Okinawa. I remember one point I had a patient and they were in a motorcycle accident,
Oh, wow.
and their whole leg was swollen. And the thing is, when I was going from I started up at the hip,
Mm-hmm.
and then I did the first was the top part of the femur.
Yeah.
And then at the very end of that image, I caught like, what looked like a fracture. So I thought maybe it was just a simple, through and through fracture.
Yeah.
And then when I got to that second half, all the way down to about where his foot was, I looked like somebody had taken his bones, crunched them up, and just sprinkled them.
Wow. His leg was completely shattered.
It was, yeah. And being a new tech back then too, that was like, I felt so bad because I was like, wow, this is a lot. I did the best I could to get the images I could.
Yeah.
I think they did CT so they could do 3D reconstruction with it later.
Okay.
But yeah, you do have those kinds of intense moments too. So it's a good job, but I think that would probably be like the closest thing I'd say to cons is just you have intense moments and sometimes challenging moments too, because not every person that you image is able to simply just walk over, put their extremity down and say, I'm here for my hand x-ray.
Yeah.
Sometimes you have to work with folks that are in, accidents where you have to really think outside the box in order to get the image that you need. So it can be challenging sometimes, but I will say that you definitely get a good sense of accomplishment when you can, overcome those challenges.
Yeah.
So.
And is there ever an instance where the patient is resistant to kind of what, you're like, hey, we need your hand this way.
Oh yes.
What do you do in those circumstances?
That reminds me, and it's not the most resistant, but for some reason, when you ask me that, it reminds me of, I want to say it was my 26th birthday.
Okay.
My 26th birthday, I was about to go home, and I remember the ICU called and they said, we need a quadruple DVT scan for ultrasound, and that's deep vein thrombosis. And they wanted both lower extremities and upper. And it's, maybe one thing to do one or two, but I had never done 4 back to back like that.
Oh,
and I was about to, kind of clock out, but I couldn't because they requested.
Yeah.
So I went to the radiologist. I'm like, can't we like do another scan on him? Because this is going to take me a lot because he's in bed too. And they just looked at me and they're like, no. I'm like, but it's my birthday, sir. He was like, sorry, but you got to do it. I'm like, and let me tell you, when I got up there, I'm very, and I learned, I'm glad I thought to do this first. I started with the lower extremities first, and he didn't want to be in bed, so he's kind of rolling around a lot, and I'm trying to make sure I'm getting good, accurate images. I started on the lowers because by the time I just got to the uppers, he started, peeing and pooping, and
really,
I was very glad I went for the lowers first. That would have been a lot worse, and it would have made my birthday a bit more special than I would have wanted it to be. But, oh man. So you do get resistance, not just, even though that was an ultrasound one, sometimes you do get resistance from patients when, you're just doing maybe like a regular x-ray. Sometimes if let's say maybe you have to scan a patient who's intoxicated, sometimes you have to, or not even intoxicated, maybe they might be like incredibly tired or, maybe like slightly altered, but usually you have like somebody assisting you if it's something that needs to be done. But sometimes you end up in those situations. Or maybe I'm remembering another scenario. Actually, I went to a psych ward to do an image on someone. And this was back during when I was training in Balboa. And I was going along with a couple of techs. And because one of the things I really love doing is learning, and I love those challenging exams because it makes you grow. So for those watching, like always, always go for the challenge because you're going to learn so much from it. That's one thing I've learned for life. But I remember when I got there, they're like kind of helping me set up to go in and do the x-ray. And I thought they were behind me. And then when I turned around, cause I was going to image the patient. And when I turned around, the techs are looking at me and they're like, I'm like, why am I like, why
you get this?
I'm like, I mean, nothing happened. I was just kind of looking, I'm like, I love my instructor. They're good. It's sometimes yeah. I love I love being an x-ray tech. Man, good memories.
So where are you from? So you've mentioned places you've gone and lived. Where are you from originally?
Okay, so I was born in New Jersey.
Okay.
South part of New Jersey, near Ocean City.
Okay.
And then when I moved down to Georgia, and then after a while, I went to live in Ecuador for about 2 years with my other side.
Yeah.
And then I came back, and I lived most of my life in Marietta before I joined the military. Marietta's in Georgia.
Oh, okay.
Yeah, so kind of just north of Atlanta.
Okay.
It's funny because whenever I'm down there, folks are like, you don't necessarily have a Southern accent.
Yeah.
Then when I go up north, they're like, you don't necessarily sound, Southern or Northern either. So it's kind of like a weird mix that I got. So I guess I'm accentless sometimes, but if I get emotional, sometimes my Southern accent comes out. It's kind of funny, actually.
Cool.
Yeah, but I have throughout my time in the military, I have enjoyed the traveling I have been able to do. A lot of places I've gotten to see, a lot of people I've gotten to learn from.
Cool.
Really, it's really kind of changed my perspective and helped me grow as a person too. So,
awesome.
That's
good. Yeah, traveling does that. I want to take my kids, just travel and learn about different cultures and meet different people and see how they live, how they I heard a story recently about a guy. I don't know how recent this was. He went to Japan and he said that there weren't any trash cans, that he had to carry, like he had a drink and I'm done with it. And he's like, I don't know where to throw it away. Did you experience anything like that in Japan? I don't know if it was a certain area.
It has been kind of a while.
I don't know if it's recent, like that's a recent thing.
I don't know if it is a recent thing or not. I remember there were times where I felt like I did have to hold on to things.
Okay.
I don't know if I can't really recall whether I felt like there were places where there were no trash cans per se, but that's,
Yeah, he mentioned that. And I mean, I don't know if he was making a blanket statement like there's no trash cans in Japan anywhere, right? Or if it was just the area where he was in, or if he just noticed, hey, there's no trash cans here, so he just kind of held on to things. So I just but again, like to him, it taught him like, okay, well, I need to be careful what I consume because I'm gonna have to carry it, right? And so it's just a small little lesson he learned.
That's I mean, that's interesting.
It
has been a while, and I remember besides Okinawa, I did travel a lot in mainland.
Okay.
So I do recall I felt like times where I did have to hold my trash, but I don't know if and maybe it could have just been where I was at. There just weren't a lot, but that's interesting.
But I think traveling just does that, right? Like it's just the way different countries kind of operate. It's just different.
Yeah.
But but you learn. Hopefully, you learn something from it. So, what other than the ones do you have a most memorable scan other than the ones you've mentioned, whether good or bad?
Oh man,
one that's stuck with you.
I feel like there's definitely been a lot of moments that I've been proud of. I know as an ultrasound tech, there's a big bias sometimes for male techs because at one point there was only male techs on the hospital that were so when you have to do pelvic ultrasounds, we get a female standby.
Okay.
But I remember it felt good to kind of overcome that challenge when women, and I don't blame them because I kind of feel the same way if I was getting a testicular ultrasound. But I remember they felt uneasy initially because I am a guy. And then at the end of the exam, especially the better I got, because I always push myself to get better images each time.
Okay.
When women were like, you know what, they're like, that was better than what female techs had done for me. And not only that, but you know, they would be, they would kind of thank me. So it was good. It felt good to get past that bias and just to show that, you know, just because I'm a guy doesn't mean, you know, I'm going to do a bad scan. Ultrasound wise, that was really stuck out. For CT, I want to say that one, probably one of the most memorable, I think, was the moments when I had to scan a baby that had been injured in an IED blast in Afghanistan. And the thing is I'd never ever scanned a baby in CT ever. And when you're out in the desert, you're the expert. But she needed the scan, so I was racking my brain, you know, doing calculations, making sure everything, you know, like that she's not getting like a lot of radiation. She's getting appropriate amount, but you know, just enough where I can visualize everything properly. And then just having her on the table and just that intense moment where I'm just like looking at her breathing and just waiting for her to, you know, kind of steady it enough to where I can get a good CT scan and then hitting the button, getting a really good scan for her that really made a difference. And I felt good. For man, it's cool. I've definitely got some good memories of each modality on that. Even shipboard, I had some good memories of that too, not only doing for x-rays, but even being, you know, letting the doctors know, because it's not necessarily, you're not guaranteed to get an ultrasound tech, but letting them know, hey, I can do ultrasound too. And one patient, I found I found a DVT in them, and ended up getting them back to shore and saving their life. And it really does give you like a really good feeling, like when you are able to like get those images done and overcome those challenges.
And is that common in what you do here? Is it common for you to know the end result of, like, you have someone and you scan and you send the results off? Is it common for you to know what happens with them? Or is it just kind of like, I did my job and then I don't really hear the other side of it?
No, it depends. Usually what I'll do is, you know, I like to ask questions a lot. And sometimes when you are doing the scan, if you do notice something that you definitely feel is concerning, you know, you are able to go for military side and civilian side too, especially once you earn their trust. But, you know, there would be times when I would go to the radiologist and I'd be like, hey, you need to see this, you know, and just kind of bring it up to them. You know, I might not be able to make any kind of official statements regarding somebody's images. But you definitely, there are times when you got to get that doctor involved. So I don't normally know the end result of a patient. But as far as their images go, I do like to kind of read what the radiologist will dictate sometimes, because it gives me an understanding of what I'm looking at too. So that way I can be a better tech. You know, I might not be able to read the images, but if I see something again that I know needs their, you know, their
attention,
that could be urgent, you know, so you learn to grow with what you see and scan.
Very cool. But as far as the tools and the equipment that you use, does it change at all? Does the technology improve? You know, or is it pretty much the same thing?
So
an X-ray is an X-ray.
That's a good question. So initially it started with film, and then it moved on to CR, which is computed tomography, where you would take the image, it would and the image receptor would, you know, collect the electrons. To kind of make it really simple, you'd put it through a reader. It would just take it out a lot quicker than it would a film, and then it would convert those signals over, and you'd get an image. Now with digital radiography or DR, images are almost instantaneous. And when I started working with radiography, I was doing CR and DR, and with the DR, it was still good, but the image receptors were fairly bulky, I would say. And I've it's gotten to the point now where the image receptors are now like very thin, almost as thin as CR. So it kind of went like maybe from some being like this thick down to this thin. So
Yeah.
more portable. And they're, I remember recently on the ship when we converted from CR, we had a CR system that was like 32 years old. We had one of the,
wow.
yeah, our ship and like another ship. I remember like kind of looking into it. I think we had like the oldest systems in the whole Navy. And I was like, man, this is a relic. When we converted to DR and we got the new one, and I was learning from the applications guy, we did like, I remember we did like a couple test images just to see like, to test functionality. And I was kind of curious because he'd mentioned like, how kind of up to date the system was. So I was curious to see when I put something on there to, that it's like kind of like a radiopaque, like dummy hand just for, like to test maybe hand x-rays. I was like, what if I shot this at a chest view, which is it's a much stronger beam.
Okay.
So, I changed it. I raised the KVP like up really high to normally it would burn out the image.
Okay.
But the thing is this thing was like, it looked almost like a hand. Like it came out with the same quality, even though it normally looks like a burned out image. So it's gotten to the point where the algorithms are so good, it can even make it look just about the same. Not that I recommend people do that. Don't shoot hand x-rays with chest technique for anyone to watch. But it's just the fact that the algorithms for that got so strong. And not only that, but with the image receptor. So when I started out, you use grids. And grids help filter the scatter radiation, so they help clean up the image.
Okay.
With this one, you didn't need to use a grid.
Yeah.
And honestly, that not only do you have a lighter image receptor, or but now you don't have to work with grids anymore.
Yeah.
It's becoming more streamlined as far as the technology goes. And that's just the tip of the iceberg. I could probably talk about each modality and tell you how it's looking
how all
for
the systems are improving.
If you like to hear it, I can I can give you a good recap. It's looking good. I'll probably just go ahead and do that real quick. Actually,
go ahead.
So for CT and for most of them too, but I think for CT a lot, AI is kind of a big factor into that.
Okay.
AI can be used to not only clean up the image, but also help with reconstruction. AI can be used to assist with diagnosis as well. I remember reading a study where they did a comparison between radiologists and AI, I think was 1.9% more accurate than radiologists.
Wow.
The only reason we don't rely on AI is because sometimes AI would miss crucial things like pneumonia, like obvious things that, you should catch, it wouldn't catch. But, as far as that goes, working hand in hand, and that's where I see AI. Yeah. It's a good tool to kind of help, like, with the system of checks. And I think CT would probably benefit the most from AI because of how fast paced it is. Yeah. And it can also help with X-ray too, in that respect. For ultrasound, they're looking into robotics. So one of the things I remember reading is they're looking into using like robotic hands that you can kind of manipulate a transducer with if you're like overseas. Yeah. So let's say, I can't deploy, and let's say I'm a civilian, I can't deploy to like, Iraq or Afghanistan. What I could do is remotely, I could operate that robotic hand and I could do scans using that robotic hand on somebody. I've
seen that with surgery. Is that something, I don't know if it was, like you said, it's something they're testing out or if it's already a thing. I've seen it with surgery where the doctors are,
Yeah. I haven't personally seen like, I've read that a few times and I think, eventually it'll become a reality. Because I've kind of I have to wrap my hand around that. Cause I know, having that hands-on experience, I'm like that hand's gotta, like what if that hand puts too much pressure and it doesn't register, but maybe I'm thinking maybe the hand has like sensors. So like if you're put too much pressure, it'll kind of put resistance on you if you're using it. So that's kind of an interesting thing. And then for MRI,
Mm-hmm.
and I kind of like this because I think it serves two ways.
Mm-hmm.
MRI, they're looking at the possibility of doing remote MRI
Okay.
because of the nature of the modality. So, in other words, let's say I wanted to be an MRI tech but work from home.
Mm-hmm.
I could work on my computer and operate 3 MRI machines in tandem.
Oh, nice.
And what would happen is the facility would have, they'd have like a level 2 MRI safety personnel and
Mm-hmm.
probably an MRI tech there just in case the connection got disrupted between
Yeah.
me and the machines. So that way they could, take over and, complete the scan
Yeah.
if possible. But they're looking at remote work for MRI. And I think
Oh.
that's cool because they were kind of like looking into the possibility of like kind of increasing output because
Mm-hmm.
MRI is cool, but it is kind of more time consuming,
Okay.
just naturally because of how you're manipulating the magnetic resonance in order
Mm-hmm.
to get the images you want.
Yeah.
Um, when I read that, I thought that was really cool because I think for people who are not able to really be on their feet as much, like
Yeah.
somebody who may be, unfortunately, they might be chair bound or,
Okay.
they might not be able to work in a hospital setting, but they're able to at least work
Mm.
remotely on their
Yeah.
computers. I think that's a good opportunity to, allow them that opportunity to work in
Yeah.
the medical field. So
Yeah.
when I read that, I was like, that's, that really opens up options for people.
Yeah.
So I think that's going to be cool if it can be something
Yeah.
mainstream. I think for all this stuff, they're still working out on possible
Yeah.
kinks, but I'm really looking forward to kind of the future it has
Yeah.
as a modality. So yeah.
Very cool. Yeah, I like that you mentioned AI being a tool. Cause yeah, they're still working out the kinks. A friend of mine sent me, he was like, "Hey, tell Chat GPT to spell strawberry and then ask it how many R's." And it didn't recognize the double R in the berry. So
Oh,
it said strawberry has 2 R's. And then it does it for all the berries, strawberry, raspberry, all the berries.
yeah.
It doesn't recognize it wouldn't recognize the double R, which is a simple mistake. But
Hmm.
in your line of work, it's crucial that they just continue training those systems but no, like you said, I think AI is a tool, right? And it aids us in the work that we're doing as humans and Um, yeah, I don't think people should be afraid that, oh yeah, he's gonna take over and take our jobs, right? Like I think it's just a tool. It's just a tool and it enhances what we do, what we're already doing. Makes it faster, makes it better, makes it and so very cool, man. Um what what advice would you give someone that is interested? So I mentioned when you got here, my daughter wants to be a rad tech. I don't know how she heard about it. Um, I don't know much about it. I'm learning a lot from you. What advice would you give her kind of as she's interested in kind of your line of work?
Go for it. You won't regret it.
Oh, very
No.
cool. I like
Well,
that.
yeah, um, that's kind of the first thought that kind of pops up.
Yeah.
If she does, great on her because she's gonna have a good career
Uh-huh.
with it. But
Yeah.
that being said, it's kind of some advice I would give is if you are pursuing it,
Mm-hmm.
definitely take the initiative.
Yeah.
Especially when you go through the learning process of it,
Uh-huh.
definitely go for the big challenges when it comes to exams, especially when you get to have somebody kind of show you the ropes and,
Mm-hmm.
be your mentor. The harder the exam, the better you'll grow.
Yeah.
So yeah, always tackle those big challenges. For me, even though some people sometimes say I'm articulate,
Yeah.
I'm not really the best when it comes to certain things. Like
Yeah.
when I joined the military, one of my weakest areas was like comprehension.
Okay.
Like I was so bad at it, like people thought I failed my ASVAB when I was taking that section because
Okay.
I spent so long. So I'm not like good at reading. But one thing that I will say, even for people who might have comprehension as their weakest area,
Yeah.
is reading, even just like a little bit, because it's going to be very it's going to be very different. It's you might have a little bit trouble understanding things initially,
Yeah.
um, But I usually encourage people, hey, like if that's the case, read a little bit.
Mm-hmm.
You don't necessarily have to spend a whole lot of time, maybe just like 10 minutes or maybe 10 pages.
Yeah.
But each time you read, you're going to get a little bit of familiarity,
Mm.
and that's going to end up spiraling down to flexibility.
Yeah.
And the cool thing about that is even if you don't necessarily understand the term, you
Mm-hmm.
kind of understand the functionality that people are speaking to.
Okay.
So you kind of understand the context a little bit. So it does
Yeah.
help aid in learning and collecting more knowledge. So definitely, make sure you're reading, familiarizing yourself.
Yeah.
And then of course, I would say for a big one too is just like accountability.
Mm-hmm.
Is just because I will say there are times when I have made mistakes before, and owning up to them is ultimately gonna have people like look at you as more human, give you respect. And when you're in
Mm-hmm.
that learning process, they'll
Yeah.
trust you more. So they're
Yeah.
going to teach you like they're going to be
Yeah.
more willing to teach you, and you're usually going to learn a lot.
Yeah.
You're going to learn like the deep stuff from them too.
Yeah.
And then yeah, when and probably just like being tough too. Like when
Yeah.
those challenges come up, like just take that deep breath in.
Yeah.
You're
Embrace it.
yeah. So you're not always going to win every battle in
Yeah.
terms of like you might have instances where I've had instances where there were times when I couldn't get the image.
Yeah.
There were times it was that kind of a tough circumstance,
Yeah.
but nevertheless you still give it your all, and
Yeah.
you learn from that. So
Oh, interesting. I didn't think about that, about not being able to get an image. So then what do you tell the...
you do the best you can.
Okay.
I know for ultrasound, we had an issue, and we were doing ultrasounds on a lady, and
Mm-hmm.
she had, I think, 3 prior, and I was like the 4th time for doing a pelvic ultrasound,
Okay.
where the doctors were insistent on ruling out DVT.
Mm-hmm.
I mean, not DVT, uh, ovarian torsion.
Mm-hmm.
The only thing though is she had had a CT scan before, and it showed that she was very what's the word I'm looking for? She was very backed up. She was constipated.
Okay.
But it was tough normally to find it because she's
Yeah.
also, she's also about like 350
Oh,
pounds,
yeah.
and she also had her uterus removed. And
Oh, wow.
so when you're doing ultrasound, you have all this bowel that's blocking the
Mm-hmm.
ovaries, and
Okay.
because there's no uterus attaching, they're free floating. So it made it really difficult to like image them.
Yeah.
So that's, and sometimes you have those circumstances where
Yeah.
in this case, because I was the 4th and they kept sending this poor woman back to get scanned,
Yeah.
I did take a bit extra time to make sure I got both ovaries.
Okay.
But the reality is you're not supposed to spend the whole day like trying to get the perfect image for somebody. You give it a good 2, maybe 3 attempts if you think you can get it on the 3rd.
Yeah.
I know when I was starting to learn out, sometimes if I couldn't get it on maybe the 2nd attempt, I would ask a more senior tech, hey,
Yeah.
for some reason I'm not getting this image. Can you help me out? But
Yeah.
there's times when even like senior techs have just been unable to get an image just because of
Yeah.
maybe the nature of somebody's anatomy. I scanned a woman with ribs one time, and for some reason, I don't know if it was her bones, her cartilage was dense,
Mm-hmm.
but for some reason I just couldn't see anything at all when I put it
Really?
was so weird. And the thing is I was actually like kind of a senior tech helping someone out who called
Yeah.
me over,
Okay.
and I was like, oh, maybe you're just having trouble with the ribs. And sure enough, I'm like, wow, I really can't see anything. Like this
Wow.
is
So you couldn't see her ribs?
like I couldn't. So when I'm doing ultrasound,
Mm-hmm.
I use kind of like the space in between the ribs
Okay.
in order to in order to kind of
To like locate yourself.
to
Okay.
view the anatomy, because
Okay.
the ribs, because they're dense in their bone,
Mm-hmm.
they block out the sound waves from going through,
Okay.
so you don't get that echo back, and it looks like a big shadow cast.
Oh, okay.
But for some reason, whenever I was scanning, I just couldn't see anything, and I just thought it was the weirdest thing, because I'm like, I had to. At that point, I did the very best I could to get as
Yeah.
much as possible, but I was
Yeah.
like, I was like, hey,
Oh, interesting.
Yeah, there are times when it does get like I think for me at least, it does get personally frustrating when I
Yeah.
can't get the image,
Yeah.
because I'm like, man, like, because I always push myself to try and get those, but I have to
Yeah.
just calm down and realize, hey,
Yeah. I did my
I
best.
gave
Yeah.
it my best,
Yeah.
and then just kind of maybe I usually kind of think about, maybe like, did I do something? I kind of like sort of reflect afterwards just
Yeah.
to see, maybe it was something I was missing, or maybe sometimes patients have certain anatomy that makes it hard to
Yeah.
visualize things sometimes. So,
Have you ever I had a friend that I don't know how he found out, but he was born with one kidney.
oh,
Have you ever like scanned someone and then you find something unusual where it's not like a medical
yeah.
it's not like, oh, I need to alert the doctor because this is a problem, but more you're like, this person only has one kidney, or have you ever
Yes,
discovered something like that?
I've seen a good bit.
Uh-huh.
So yeah, I've seen, to speak on what
Mhm.
your friend might have been talking about.
Yeah.
I've seen like instances of like a horseshoe kidney where they're both
Mhm.
kind of connected and it sort of wraps
Okay.
around.
Yeah.
Um, I've seen instances of like kind of two uteri where they're kind of split off.
Yeah.
So she has like, yeah. And at first I thought maybe the
Interesting.
equipment was malfunctioning. And
Yeah.
so I remember I did the best I could. And then I went and talked with my senior techs. I'm like, this
Yeah.
is what I saw is this. And she responded, oh yeah, yeah, that's it. And she told me, yeah, sometimes it doesn't happen often,
Interesting.
but
Yeah.
sometimes, um, yeah, man, I've seen stuff, like that. There was only one time, and it's very good to mark your anatomy properly too when you do this, but
Okay.
there's only one case I ever saw of sinus inversus, and
What
that
was that?
means that your organs are flipped on the opposite side. So your heart's normally
Really?
on your left
Yeah,
side,
yeah.
but on this patient, they were on the right side instead.
Really?
Yeah. So it was it was very trippy, and I had to look at it, and then I looked back at my marker because I thought maybe I put it on the wrong side. And
Yeah.
nope, sure enough, it
Really?
was an actual case of sinus inversus. And I was kind of blown away.
And do they live normal lives with their
I,
organs just flipped?
yeah, it doesn't necessarily. It's just like how their anatomy's set up.
Yeah,
But it
yeah.
is important to know for, like, let's say surgical reasons, for
Yeah.
example, because if you think their heart's on the left side and you're maybe
Yeah.
doing like open heart surgery
Yeah.
right there, and you're like, where's the
Like,
heart? Yeah, there's a lot of
do
medical.
you were did you end up telling them? Like, did they find out from you, like, hey, my anatomy's backwards?
That's a good question, actually. And this is a very important thing that you have to remember. As
Yeah.
a rad tech, you can't tell the patient, you can't really diagnose things. Now you can,
Okay.
there are certain circumstances where if I'm allowed to,
Mhm.
you can kind of show the patient their images,
Yeah.
but I can't diagnose them. And I can't let them
Okay.
take pictures usually
Okay.
because there's PII displayed. So you can
Yeah.
kind of let them like take a glance at their images. I do
Mm.
that at least, but I never diagnose.
Mm.
If they are very concerned,
Yeah.
to the point where I think it could, have a negative impact,
Yeah.
I usually have them, just like wait right there. And if the radiologist is available, I might ask them, sir, are you able to maybe, like, especially if I see something I know that exists, I'm like, hey,
Yeah.
are you able to maybe like come out and talk to the patient in private real quick and
Mm.
just let them, kind of give,
Yeah, yeah.
and it's not usually an official thing because they
Yeah.
still have to, but as a doctor, they're able to give something more definitive
Okay.
because it's not within my scope of practice to make
Yeah.
those calls.
Yeah.
That would be and even for military, I would only be able to do that at like the most extreme of situations. Like if
Mm.
let's say maybe it's only me and an IDC,
Yeah.
the IDC might ask for my opinion just because, if there's nobody else available, and because I usually have more exposure than what the independent duty corpsman has,
Yeah.
that would be the only time that I would give
Mm.
them their opinion. And
Yeah.
it would still be them to be responsible with what
Mm.
they do with that information.
Very
But
cool.
yeah, it's so yeah,
Yeah.
it would be kind of cool if I could say like, hey, you have you have this going on. I
Did you
didn't know.
Yeah.
Yeah, and then sometimes it's yeah. and sometimes you have to keep a poker face because sometimes there have been circumstances or like I remember at one point for a female patient, she didn't know she was pregnant, and
oh wow,
yeah, I had to. I mean, but I think she ended up like kind of glancing over at the screen and seeing, and she's like, "Am I pregnant?" I was like, I'm taking images. I can't confirm anything. I'm not a doctor. I'm not going to make that determination. And she's just looking at me like I'm crazy. Like, what do you mean? Like, I see the baby. Like, she's kind of like, she's getting a little hysterical because, initially she didn't want the baby.
Wow.
But, it was weird because the more she saw the baby on the screen, it turned it to, initially she really didn't want it. But then like 30 minutes later, she was in love with it.
Wow.
It was so weird, like the transformation. But she was just really poking at it. She's just like, why can't you just be honest with me? I'm like, that's not my job. I can get in serious.
I get in trouble. Yeah,
absolutely. So yeah. Yeah. But
very interesting.
Yeah. Sometimes you really get those urges of wanting to ask, and sometimes you can kind of get around it. Like if you want to collect more information, like if I take a picture and, I see something in the picture, I might, and one of the most common things is piercings. So, I'll usually ask just to differentiate because most of the times it's piercings, but I've had maybe one or two circumstances where the patient has had like staples and they look like piercings for some reason.
Okay.
So if I see something, then I might ask the patient, "Hey, by any chance, do you have like piercings or, or if I think it's surgical clips, even I'll be like, "Hey, did you have surgery at all?" Just to kind of confirm. Because if for some reason they say, that they didn't, and, I see something weird, then, that's when I'm on my brain, depending on what it is, I may just bring up to the radiologist and be like, "Hey, I just want to confirm that this is, but
that's interesting. I like that.
Yeah.
So I have two questions.
Of course.
You're going to be the first episode that I do this on. My wife gave me this idea. And I was like, that's a cool idea. So just two questions. The first one is, how would you define success?
Ooh.
There's no wrong answers.
Good questions. Oh man. I like to get deep into my questions.
At this point in your life, what does success mean to you?
Man. I feel like my answer is probably going to change later on tonight. But
no worries.
I think at this moment for me, I would kind of look at success as more so having that gumption not to give up.
Okay.
I think that successful people have that drive even in like the toughest of times.
Yeah.
And success doesn't necessarily equal certain results. Like you don't have to have a certain amount of money to be successful. It's more along the lines of whether you accomplish what you set out for, and how you go about with those accomplishments. I might not have the most money, but if I'm able to, pursue the things I want and acquire, achieve them, I think that's, that you could say I am successful because that's what, brings me forward. So that'd probably be the best way I could put it, is just, it doesn't necessarily, I mean, I could be making a lot of money, but I might not really consider myself successful if I'm not really meeting my goals. But even then, it's just having got like clear path and going forward. Like successful people, whether they succeed in attaining their goals or not, it's just, I think it might just ultimately be like a state of mind for how you go forward for things too. So
I like that.
Thanks.
Very cool. I like that. The other one is, what did your parents how did they guide you into, hey, you're going to be an adult, like you've got to, you got to do something, like what, how did what was that conversation like, or what was that?
I kind of grew up in a single parent household.
Okay.
So my mom was kind of working a lot. I don't know if we really had any conversations about kind of what I wanted to do more so.
Okay.
I think for my mind, it's kind of been changing a lot too. Because I know initially when I was in high school, I wanted to be an anesthesiologist.
Okay.
Mainly because of all the money they made.
Yeah.
And I was like, oh, I just have to do is gas people and put them to sleep. And I get paid for that, man.
Yeah.
It's, it almost seems criminal to a certain degree that I'm making that much money. But yeah, I mean, there's more to that, obviously. But and then at one point, I remember wanting to become a firefighter because I was thinking about it. I was like, well, I work 1 day a week, but, I get to stay in great shape. People love firefighters too. They get to do cool things. You get to go around, be like, a neighborhood hero in a way. And then I think for that one, it kind of got a little harder because they were looking to hire people who were EMT certified, which was funny because later I got mine, when I went to Okinawa, actually. That's another story. But it was weird because I was an x-ray tech, but my LPO at the time was like, no, but I think you should get this. And so I was like, okay, well, I'll just get that too. So that was actually the first medical certification I got.
Oh,
but
nice.
So I think kind of growing up in my environment, it was more of not real. I don't know if my mom really was worried about my future as much as if I guess maybe I was more active in the planning of process of it too. I think she saw that because I would try to move forward and kind of keep my head going. I think she wasn't really was worried about, what her son was going to do just because, I didn't really have that kind of, I'm going to just kind of stop attitude. So I think for her, it was just more so like, we kind of stuck to the basics as a family, just, getting dinner set and, just like kind of those basics of togetherness. But I think ultimately, it was, I know like every now and then she calls, she's like, I'm so proud of you and stuff. And I'm like, thanks mom. I appreciate it. It was like a little embarrassing, but moms will be moms. And, that's something that, all children have to understand that moms will be moms and you have to let them be moms. Respect your parents, kids. That's very vital. They love you. So
yes, they do.
Yeah, they do. So that was.
My mom still calls me. I'm the youngest of 5.
Oh,
and my mom still calls me baby. She's like, hi, baby. I'm baby.
It's she doesn't do it to bug you. It's just you. That's how she shows how you mean a lot to her. So
very cool. Man, that's good. I appreciate you coming on the show. I learned a lot. It was very interesting. No, thank you so much, and I'm sure it's gonna help someone. Because I didn't know all the different avenues that you can take off of this.
I'm not even diving into the deep end. If I did, we probably
a lot more.
We might be talking for like maybe 3 or 4 hours, but it's.
Well, maybe I'll have you back. Because now you said you're going into the training side.
So as far as being an instructor, because now I get to teach radiology, so that's gonna be kind of a fun avenue for me to go, and then hopefully once I get done with that, I jump back in and I get my MRI certification. Then I'll be 3-qualified, and we'll kind of see where things go from there. But who knows, man? Maybe it'll all lead to a different career experience. But
you never know.
But that's the cool thing about radiology. Even if for some reason I went a different route, and I had I got like medically separated or from the military. Stable job waiting for me outside.
That's perfect. Well, lots of possibilities, and maybe one day you'll come back and talk about the training side or something else that you're doing.
That'll be fun.
Very cool,
I'd
man.
love to.
Well, thank you for coming on the show. We're gonna wrap it up. Thank you guys for tuning in to My Line of Work. If today's story inspired or intrigued you, don't forget to give this video a thumbs up. Subscribe to the channel and hit the bell icon so you never miss an episode. If there's a career you're curious about, drop it in the comments below. We'd love to feature it. And hasta la próxima. Cool. Thanks, man.